GCP2 resources and using them alongside with the early help assessments, there has been quite a few queries and contacts in regards to, do we use both? Do we only use one? What are the correlations? What are the differences? And what are the similarities? I'm going to try and keep it simple today because it is simple. When we actually are completing our early help assessment, that is from the referral that we receive. And we receive that either from the front door, or we actually have a look at them during audit stage as well with other services and providers. The early help assessment is in regards to finding out more about the family. We use the outcome star. So in all of those elements of the outcome star, we get a real picture holistically of where the family are. And that's where we are when we use the family star. We are looking at the point of where they are at and where they need to go to achieve those positive outcomes. When we use the outcome star, the big difference is from the GCP2 is that we use a scaling rather than a scoring. And when we use the scaling, we actually see that one is actually that they are stuck. Okay, so they're very stuck, they need help, they need that support, they need the hand holding, and we move up the scale in the regards of the journey of change and where they are. Now that's very different, isn't it, to the GCP2, where we actually look at 1 is good and then 5 is bad. So the terminology is different, but the similarities is that you can use the traffic light system of the colour coding, which means that if you are using the early help assessment alongside the GCP2, you can use that visual of the colours meaning the same, so what you're trying to achieve in the outcomes. So that's one of the differences, but the similarity would be the colour coding and the traffic light system. What we do say is that when we complete the early help assessment, we are finding out that information and finding out the support needs that we need to focus on and prioritise to achieve outcomes. What we also say for the GCP2 is that we need to build a relationship with the family in regards of finding out more about where they are at the point of their journey of change also. That's a similarity. The difference is that we wouldn't ask someone to do a GCP2 immediately on meeting a family unless we're looking at maybe working with safeguarding colleagues where that needs to be initiated in the first instance. Very much so when we're working with early help, we would complete the assessment first and then finding out the information and the priorities of need, it may then be identified that we would then complete the GCP2. I think there is a little bit of confusion sometimes with staff that they have to use both of them. There isn't. We would only use the GCP2 if there are indicators of neglect. So that's something else that I've had to advise many staff members on, is that, you know, this isn't something mandatory that you would use all the time. The early help assessment is mandatory in regards to offering early help, and we have to complete that. The GCP2 is something that obviously you would find in your analysis and within your action plan, that that's something that you would like to complete with the family. So it's really trying to get the message across that, you know, that it isn't an overwhelming beast that we're asking them to do in regards of mammoth of assessment and writing and documentation. The actual tool of the GCP2 is what we can use. It's not, doesn't have to be the full assessment. We can just use the questions and the tool to have the conversations with the families. So that's just a little overview. Do any of you have any further questions or any input, actually?
Just to kind of echo your point really about, I've come across a few and they're kind of co-working cases where maybe the IRO's requested the graded care being done, and actually, you know, it's my staff that might be co-working with them and doing it, and I'm coming into supervision and it's not appropriate for it to be done. So yeah, whether that message needs to come across even more, that it doesn't mean every family needs a graded care. It's got to be appropriate, because a lot of them, they're scoring really high. It's not the neglect side, it's the other things. So I found that quite a lot recently, that they've been done for no purpose at all. And also then the ones that we do want to get into to get done are the hardest families to get across, to try and sell it to them and to explain it, and the engagement. So yeah, that's just a barrier. Sometimes, you know, we might do the early help assessment and we know we need to do graded care, but it'll be months before we even start it because we're trying to introduce it.
Absolutely. And that's what we always say, don't we, as champions, is that this really isn't a tool that we want to introduce very, very early on in intervention. You know, we do need to build that relationship with the family, particularly our resistant families as well.
Yeah.
Anything else?
No, that's lovely. Thank you very much, Mel. Really appreciate
No problem. Have we stopped recording?